Welcome to the deep dive. Today we are looking at a medical mystery that honestly it impacts millions of people. And the solution we're exploring today is going to completely challenge everything you think you know about how we treat chronic illness.
Yeah, it really does upend the whole paradigm.
Right. Think about taking your car to the mechanic because it keeps stalling out. The mechanic checks the oil, he inspects the belts, looks for physical leaks under the hood, and then he tells you the engine is in perfect shape.
But the car still won't drive.
Exactly. The car won't drive. Because the problem isn't a cracked pipe or a broken gear. It's a corrupted line of code in the car's onboard computer.
Which is such a good analogy for what we're talking about today.
Right, because traditional medicine is incredibly good at finding those physical leaks. You know, you break your arm, the x-ray shows a jagged white line, and the doctor points right to it, broken or not broken. It's this very comforting binary system.
But when you step into the world of post-viral syndromes, that diagnostic hardware suddenly just comes up completely empty. We're looking at an illness landscape where the traditional tests fail because they're looking for physical damage when the issue is fundamentally, like you said, a software glitch in the nervous system.
Millions of people are currently navigating this invisible condition. We're talking about long COVID, of course.
Right.
And it's a syndrome with no standard cure, right? There are no broad treatment options that just work for everyone.
None, which is why the source material we're pulling from today is just so fascinating.
It really is. So we're looking at a 2024 peer-reviewed medical case report. This was published in Clinical Case Reports, and it was authored by researchers from Johns Hopkins, UC San Diego, and NYU.
Heavy hitters.
Yeah, totally. And it details a patient who found complete remission from severe long COVID. But she didn't find this remission in a standard pharmacy.
No, she didn't.
She utilized a highly stigmatized, completely unconventional and ancient method.
Right. We're examining a clinical protocol that involves a combination of MDMA and psilocybin.
Which people know as magic mushrooms.
Yeah. Exactly. Commonly known as magic mushrooms. Our objective today is to look past all the sensationalized headlines, and really understand the actual neurobiological mechanics of this N-of-1 study.
And just to clarify for you listening, an N-of-1 study basically means this is a rigorously documented report focused entirely on the clinical timeline of a single patient.
Right. It's not a massive clinical trial with thousands of people.
Exactly. Okay, let's unpack this. We need to establish the absolute baseline of this patient before we can even begin to comprehend the intervention. So set the scene for us. Who is this patient and, what was her life like before the infection?
We're looking at a 41-year-old female who was, by all conventional metrics, just thriving. I mean, she was actively pursuing her PhD.
Oh, wow.
Yeah. Her BMI was 27.4. She did have a history of intermittent manageable migraines since she was a teenager.
Okay, so she got headaches before.
Right, occurring maybe 2 to 4 times a month. But otherwise, she was completely healthy. She was also fully vaccinated, having had 2 doses of the Pfizer vaccine and a Moderna booster. And then she contracted COVID-19 in February of 2022.
And the acute phase of her infection was honestly somewhat typical. Fever, cough, fatigue, body aches, sore throat, the usual.
Yeah, the standard acute symptoms.
But there was this one incredibly bizarre sensory detail in the clinical notes. She lost her sense of smell, which is normal for COVID, but her sense of taste was intensely altered in a specific way. She reported that absolutely everything she ate tasted overwhelmingly salty.
And that specific sensory distortion is a crucial early clinical indicator.
Really? How so?
It tells us that the virus is fundamentally interfering with neurological processing. The sensory pathways that interpret chemical signals from the tongue are literally glitching.
Wow.
For most people, that acute neurological interference resolves as the virus clears. Your taste goes back to normal. But for this patient, as March 2022 rolls around, so a full month after her initial diagnosis, the respiratory symptoms fade away, but the long COVID condition fully takes hold.
Her life effectively just stops. The report details severe anxiety, deep depression, and this profound brain fog. She's suddenly struggling with basic reading comprehension.
Which is devastating.
Right. For a PhD student, that's a career-ending symptom. She lost her short-term memory, her word-finding abilities, and then she developed severe joint pain, like radiating through her hips, knees, shoulders, and even her jaw.
Yeah, the systemic inflammation is intense.
Her libido completely crashed. And on top of all of that, she developed a new, terrifying headache.
And the clinical distinction of this headache is so vital here. The report clearly separates this from her pre-existing adolescent migraines.
It wasn't just a worse version of her normal headaches.
Exactly.
Yeah.
This new symptom was a daily, global, pressure-like sensation that encompassed her entire head. It wasn't triggered by light or sound.
Right, no photophobia or nausea associated with it.
Just this immense, crushing pressure lasting anywhere from 2 to 12 hours every single day.
I mean, if you've ever had a doctor tell you that your blood work is fine when you feel absolutely terrible, you know exactly how maddening this next phase is for her. She goes to her doctors seeking that clear, broken bone style diagnosis.
Of course. She wants an answer.
They run a complete blood count. They run a basic metabolic panel. They check her coagulation values, inflammatory biomarkers. They even test her troponin levels just to look for heart muscle damage. They do a chest x-ray. Everything.
And every single test comes back within normal limits.
It's crazy.
For sodium, potassium, glucose, white blood cell count, it is all perfectly normal. This perfectly illustrates the physiological mystery of long COVID, which is known clinically as PASC, that's post-acute sequelae of SARS-CoV-2 infection.
Right.
Traditional medicine relies heavily on objective, measurable biomarkers. When those are absent, the standard treatment pathways just often hit a brick wall.
And she tried everything the traditional system had to offer. She was taking 200 milligrams of dimenhydrinate daily for 3 months, literally just to fight the insomnia.
That's a heavy dose.
For the daily head pressure, she was taking sumatriptan and naproxen sodium. That combination gave her maybe like a 60% subjective improvement, but the core pain was still there.
Yeah, it was just masking it.
She tried graded physical therapy, massage therapy, intermittent fasting, chiropractic care, osteopathic therapy. She even did an acupuncture session that gave her this fleeting 15% relief, but it just evaporated before the day was even over.
And eventually she gets referred to a specialized long COVID clinic.
But she was waitlisted for months. Imagine that. Your life is falling apart and you just have to wait.
What's fascinating here is that traditional rehab and physical therapy, they fail in these PICC cases because the underlying mechanism isn't a simple physical injury. Like I said earlier, you cannot stretch or ice away a corrupted neural network.
Right. So by August and September, she is stuck in this agonizing holding pattern. And driven by profound desperation, working under the guidance of a therapist, she decides to explore an avenue entirely outside the traditional medical system.
She pivots to a highly illegal scheduleless eye drug protocol.
Right. Here's where it gets really interesting. How did they actually structure this? Because this isn't just someone, casually experimenting at a music festival on a weekend. The report provides a highly structured, exact timeline of the intervention.
Yeah, it's very clinical. Her first intervention occurs on May 5th, 2022. She consumes 1 gram of dried, whole, golden teacher psilocybin cubensis mushrooms.
Which she just bought from an online store.
Exactly.
And the result of that first 1 gram dose was a modest 20% improvement in her overall symptoms. The depression, the fatigue, the joint pain, it all dialed back slightly, and that relief held for about 7 days.
But the report notes it wasn't a comfortable process at all.
No. She experienced severe shivering and chills, like a deep physical sensation of being freezing cold while the psychedelics were kicking in.
And that intense physical discomfort is actually a known physiological response during the onset of psilocybin.
Really? Why does that happen?
It relates directly to how the compound interacts with serotonin receptors, specifically the 5-HT2A receptors, which are heavily concentrated in the gut and the central nervous system. It's a clear sign that the nervous system is being massively stimulated.
Okay, that makes sense.
But because she achieved that 20% window of relief, she and her therapist decide to adjust the protocol and attempt a much more complex pharmacological intervention 24 days later.
Which brings us to May 29th, 2022. This is the date everything changes. They utilize a stacking method. So what does that specific timeline look like, and what exactly is she taking?
Okay, so they initiate the stack with a single 125 milligram dose of MDMA.
Okay.
Then they wait exactly 1 hour. Then she consumes 2 grams of whole dried golden teacher psilocybin mushrooms, which were prepared in a tea.
Got it.
They wait another hour, and then she ingests a second dose, another 2 grams of psilocybin tea. And the report explicitly notes that all of these substances were run through a verified drug testing service. They use getyourdrugstested.com to ensure chemical purity before ingestion.
Wow, but wait, why wait an hour? Like, why take a party drug like MDMA before consuming a heavy dose of hallucinogenic mushrooms?
It comes down to neurobiology and mitigating the brain's fear response. MDMA is classified as an empathogen. It rapidly floods the brain with serotonin, dopamine and norepinephrine.
Okay, the feel-good chemicals.
Right. But crucially, it suppresses activity in the amygdala, which is the brain's fear and threat detection center.
Oh, wow.
So by taking the MDMA first, she's chemically creating a profound sense of safety, emotional openness, and physiological warmth.
Which counteracts the shivering and anxiety she felt during her first dose.
Exactly. When the heavy neurological lifting of the psilocybin begins an hour later, the MDMA has already established this psychological safety net. She is in a state of deep trust rather than physiological panic.
That is so smart. And the subjective experience she reports during the stacked session is incredible. She notes feeling completely detached from her long COVID symptoms. She enters a childlike state, feels a deep connection to nature, and describes feeling like she's in an alternate reality.
Yeah, a classic, profound psychedelic experience.
But there is a detail in the clinical notes that I have to push back on. So, 40 minutes after ingesting the psilocybin, she experiences transient nausea and physically vomits.
Right.
Yet she simultaneously reports her pain level as an absolute 0 out of 10. Wait, she was throwing up but claimed 0 out of 10 pain. How does that even compute?
I know it sounds impossible, but it perfectly illustrates how these specific psychedelic compounds decouple the physical sensation of a bodily symptom from the emotional processing of distress.
Decouple them.
Yeah. Pain is a two-part system. There is the physical signal originating from the body, and then there is how the brain interprets, emotionalizes, and assigns suffering to that signal.
Right, the suffering part is basically mental.
Exactly. Under the influence of this MDMA and psilocybin stack, the neural pathways that generate the actual suffering associated with physical distress are temporarily quieted.
That's wild.
She was physically sick. I mean, her stomach was rejecting the fungal matter, but her brain was completely stripped of the emotional trauma normally associated with vomiting. She was entirely detached from the physical distress.
And this detachment wasn't just a temporary escape while the drugs were in her system. The aftermath of that May 29th session radically altered her trajectory.
It really did.
She reported an 80% overall improvement in her long COVID symptoms. 80%. The crushing fatigue, the anxiety, the joint pain, it all significantly faded, and that unique global head pressure dropped from occurring 5 times a week and lasting up to 12 hours down to just once a week, lasting only 2 to 4 hours.
And the functional metrics are what make this case report so compelling. Her insomnia resolved so completely that she permanently stopped taking her daily antihistamines.
Wow.
The profound brain fog lifted to a degree that allowed her to resume her PhD studies.
So she's completely cured, right?
Well, not quite.
Right. Because rewiring a traumatized brain isn't just a one-and-done event. We are looking at the concept of fragile neuroplasticity. Brains are incredibly stubborn, you know? They like to fall back into their familiar grooves.
As they do.
So 6 weeks later, around July 16th, that daily head pressure starts creeping back. It reaches about 30% of its previous peak intensity.
The neural networks were essentially attempting to revert to their inflamed, rigid state. So, to counter this, she initiates a third dosing session.
Just psilocybin this time.
Yeah, a single 2-gram dose of psilocybin tea. And that intervention knocks the symptoms down to a 90% relief threshold.
Wow.
This functional improvement allowed her to actually return to work part-time in late July, and then she progressed to full-time work by September.
So she is doing remarkably well for months. Then, in November, she catches a completely standard, non-COVID viral illness, just a regular winter bug. Instantly, the long COVID symptoms come rushing back. The global headache returns. So it wasn't a permanent cure the first time. Why does a random, unrelated flu trigger the exact same long COVID symptoms?
If we connect this to the bigger picture, it's because long COVID leaves the nervous system and the immune system in a state of profound vulnerability and hyperreactivity.
Okay.
Her system was previously traumatized by the SARS-CoV-2 virus. So when a brand new pathogen enters her system in November, her immune system flares up to fight it, which is normal.
Right, that's what it's supposed to do.
But because her neuroimmune pathways were previously damaged, that new immune response erroneously triggered the old neuroinflammatory loops. To use your earlier analogy, the hardware of her body was placed under stress, so it defaulted to running the faulty long COVID software again.
That makes total sense. But she knows how to force a reboot now?
Yes, she does.
So on November 24th, 2022, she initiates a fourth and final dosing session, 2 grams of dried psilocybin mushrooms. The result is a complete, sustained resolution of her symptoms. 3 days later, she's back at work and fully engaged in her PhD program.
Which is huge.
Yeah, I mean, you cannot simply think positive your way through a rigorous doctoral program if your short-term memory is destroyed. Her return to high-level academic work proves this is a functional biological recovery.
Which forces us to examine the deepest layer of this case report. We've mapped out the timeline and the dosages, but we have to address the neurobiology.
Yeah.
What is actually happening inside the brain's architecture to facilitate this kind of sustained healing?
We are desperate for the why. How does a hallucinogenic mushroom effectively cure a chronic post-viral syndrome? The report highlights that long COVID is driven by chronic neuroinflammation and altered connectivity within intrinsic brain networks.
And the most critical of these networks is the default mode network, or the DMN.
The DMN, let's talk about that.
The DMN is this widespread network of interacting brain regions that is highly active when you're awake but resting. It's the network responsible for daydreaming, intense self-reflection, rumination, and really how you construct your internal sense of self.
Okay.
In conditions characterized by chronic suffering, so things like severe depression, chronic pain syndromes, and apparently long COVID, the DMN becomes hyper-connected, rigid, and metabolically greedy. It gets locked into a negative inflammatory feedback loop.
Okay, so think of the default mode network like a smartphone running 50 poorly coded, incredibly heavy apps in the background at all times.
I like that.
Right. Your battery is draining in an hour, the phone is physically overheating in your palm, and whenever you try to open a new app to do something productive, the entire system glitches and freezes.
Yeah.
Long COVID essentially froze her brain's operating system by locking those inflamed background apps open. The psychedelics acted like a hard reboot. They forcefully closed out all those corrupted background processes, cleared the neurological cache, and allowed the entire network to restart with improved efficiency.
I appreciate the analogy, and honestly, when we examine the receptor-level changes, your software reboot metaphor aligns perfectly with the pharmacology.
Really?
Yeah. Psychedelics intensely bind to those 5-HT2A serotonin receptors. This binding induces massive neuroplasticity. It dramatically disrupts the rigid, hyperconnected state of the default mode network.
Wow.
The patient's own clinical notes about feeling detached from her illness perfectly describe the subjective experience of the DMN temporarily going offline. The drugs dismantle the hyper-rigid state, allowing her nervous system the flexibility to reset to a healthy baseline.
I saw a note in the source material about gene expression, which, honestly, it sounds a little sci-fi to me. How does a chemical compound in a mushroom literally talk to your DNA to fix a viral injury?
It relates to how the body produces acute phase reactants. These are proteins whose blood concentrations drastically increase or decrease in response to inflammation.
Yeah.
The research indicates that psychedelics don't just temporarily alter your mood. The receptor activation triggers intracellular signaling cascades that actually alter gene expression.
That's incredible.
They literally signal your DNA to downregulate the production of the specific proteins that cause neuroinflammation. It's a deep, biologically driven, anti-inflammatory cascade that fundamentally alters synaptic plasticity.
Wow.
That genetic modulation is likely the key to understanding why a single dose in November could resolve her relapse entirely.
It is genuinely staggering. But, if you are listening to this and wondering why your local doctor isn't prescribing a psilocybin stack for your chronic fatigue or brain fog right now, we need to ground this excitement in current medical reality.
Yeah, we absolutely do. First and foremost, both psilocybin and MDMA are currently classified by the DEA as Schedule I drugs under the Controlled Substances Act.
Right.
So from a legal standpoint, the government considers them to have no accepted medical use and a high potential for abuse.
Though the regulatory landscape is shifting, the paper notes that in June 2023, the FDA released its first draft guidance on clinical trials for psychedelic drugs. So the tide is turning. The highest levels of medical regulation are beginning to recognize the profound therapeutic potential here.
But we are still navigating the clinical Wild West. There is absolutely no consensus on standard dosing protocols for post-viral syndromes.
None at all.
No. The researchers pointed to some existing literature citing a dose of 0.143 milligrams per kilogram for treating chronic headaches. But for long COVID specifically, this case report is the very first of its kind. The natural history of this disease when treated with these specific compounds is just completely unknown.
So what does this all mean? We also cannot gloss over the severe potential side effects. This protocol is not just about connecting with nature and finding inner peace.
No, it's intense.
The clinical report explicitly lists potential adverse events. We're talking severe nausea, dizziness, dangerous transient spikes in blood pressure, intense anxiety, severe dysphoria, and serious drug interactions. The patient in this report was guided by a therapist. This was a highly calculated intervention.
This raises an important question about the inherent limitations of medical literature. Because this is an N-of-1 case report, there was no control group.
Right.
There was no blinding, no randomization, and no direct clinical oversight over the dosing protocol, as the patient procured and administered the substances herself. We cannot draw a universal cause and effect relationship from one person's biology. What
Exact.
successfully rebooted the nervous system of this 41-year-old PhD student might have zero effect on someone else, or worse, it could trigger a negative neurochemical reaction. This is about mapping the frontier of neuroscience, not giving DIY medical advice.
Exactly. Our goal with this deep dive isn't to provide medical advice. We started this discussion looking at a woman whose life had ground to a painful, foggy halt. A woman suffering from daily 12-hour head pressure, profound cognitive impairment, and severe joint pain, all while the standard medical test told her she was completely fine.
Yeah, the invisible illness.
But through a carefully guided, courageous experiment with an MDMA and psilocybin protocol, she achieved complete remission. She successfully returned to her life, her work, and her academic passions.
That incredible journey.
It really is. If you've tuned in today, I know you value getting past the surface noise. You want to understand the actual mechanics of the world without being buried in impenetrable medical jargon. We hope this deep dive gave you a clear, fascinating shortcut to understanding one of the most exciting and complex frontiers in modern medicine today.
It's a frontier that's changing rapidly.
But before we go, I want to leave you with one final thought to mull over. We talked extensively about how the neuroinflammation of long COVID essentially crashed this patient's default mode network, and how these highly stigmatized compounds acted as a hard neurological reboot.
Right.
So think about this. If a potent psychoactive compound can literally reset a complex post-viral physical syndrome by rewiring the brain's internal connectivity, what other seemingly disconnected physical ailments, things like chronic autoimmune issues, mysterious chronic pain syndromes, or chronic fatigue, might actually just be hidden network connectivity problems just waiting for the right kind of neurological reboot?
It completely reframes how we view the physical connection between the mind, the brain, and the immune system.
Keep questioning the world around you, keep looking for those hidden connections, and never stop being insanely curious. Until next time.